Good afternoon, everyone, and welcome to Breaking Barriers System of Care Masterclass Series. This is the second of 5 masterclasses we're going to have this year, and as we said previously, our intent is for them to be as interactive and participant-focused as possible. As we're beginning, I just want to make sure everybody has some ground rules. We're going to keep everybody muted so that we can manage the conversation. If you have questions or comments, please put them in the chat box. Richard and Jamie will be monitoring that, and we'll answer as many questions as we can during the presentation. As you see in the PowerPoint, we have some questions that are already set for both Judy and Melissa, but we look forward to your responses and taking the dialogue where it goes. With that, again, my name is Steve Hornberger. I'm the director of the Social Policy Institute at SDSU. And my collaborator and partner in crime on this is Richard Knecht. And Richard, you want to just introduce yourself?
Hey, Steve. Good to be with you all again. Really looking forward to the conversation today on shared leadership, and happy to be with you.
Yes, and then today we have our 2 preeminent leaders in the child and family systems in California, Judy Webber and Melissa Jacobs. And unfortunately, Judge was also supposed to come, but she had some last minute, a big case came, not able to be here today, but we will rope her in going forward. But Judy, just a quick introduction of yourself, and then Melissa?
Sure. Hi, everybody. I'm Judy Webber. I am a social worker by profession. I have been working in the public sector now for 30 years plus. I actually had some experience in the private sector as well, working for private psychiatric hospitals and local board and cares in another lifetime ago. But I am passionate about helping kids and families. Sometimes, you know, we wonder how we got to where we're at, and I've learned to just trust the universe that I'm exactly where I need to be. So thank you.
Welcome. And Melissa?
Good afternoon, everyone. My name is Melissa Jacobs. I am the division manager for child and family mental health for Sacramento County. I am a licensed clinical social worker and have been working in community mental health and social service type programs for 30 years. I oversee our child and family continuum, as well as our transition age youth continuum or service sector in Sacramento County.
Welcome, Melissa. And as always, we need to make sure we say thank you to our sponsors. MHS OAC has been a key sponsor for the master classes, but it's also important to mention that they've been a sponsor for all of the previous Breaking Barriers symposiums, with a real emphasis on supporting inclusive and diverse populations and voices attending. So thank you to them. Our Social Policy Institute is glad to be here, and Richard, as the managing partner for Integrated Human Services Group, is also a key sponsor. Now, our purpose here is really very straightforward. That we want to create a community of practice where we can learn from each other as we move forward in these transitional and transformational times. That I think we're all clear that no one system or no one silo can achieve the goals that we have for the children and youth and families that we serve in our communities. And that while it's important to have regulations and leadership from the state and the county governments, it's also been my experience that informal peer-to-peer, we can learn more quickly with one another and implement new things in a much faster way. And we don't have to wait for the regulations. And that informing policy, because the system is clearly adapting as we're going, and we need a vehicle to share what we're learning. And that's our intent of these master classes, that we engage and strengthen community voices, and that we use this as a way to begin to strengthen best practices. You know, I mean, if you remember, if you've been here for a while, you remember that there was this whole dialogue about between evidence-based practices or practice-based evidence. I think we know both are important, and that these master classes are intended to be a skill building opportunity for the integrated systems implementation, and that we're really trying to focus on how do you operationalize, how do you design and implement. This is not where we're going to have the high level policy discussions. And what I've come to appreciate over these last couple of years of being involved in this work is that clearly we're on a shared journey, and clearly it's certainly not a sprint. But I've come to appreciate over these couple of years, by learning from each other, from others, as well as just deepening my own research, that I don't think it's a marathon anymore. I think we're closer in this journey of improving the quality and the health and well-being of our children and families, much closer than we were a few years ago. So it's not a sprint, but it's also not this long marathon. And then, Richard, do you want to, since you're such a key architect for the 2083, do you want to just give us some background?
Well, Steve, thanks. There are lots of folks involved with the parallel work that's happening underneath Assembly Bill 2083. But it's important to recognize, if you're not involved in that work, if you're involved in other integrative efforts in your local community, that the 58 counties and regional center partners across the state are doing very aggressive work in the last year and a half and going forward underneath 2083 to build systems of care. And there are some critical partners outlined here. Each of those efforts will result in a local memorandum of understanding. And particularly for our historic audience here, if you're in a local school district or local education authority, while your agency is not a signatory necessarily under mandate, foster youth service partners, school-based mental health partners locally are certainly part of the service delivery vehicle, and in a local conversation can, of course, find a home within that interagency work. So just a little bit of level setting relative to AB 2083. Of course, there are other efforts and multi-tiered systems of support going on in schools, the integrative care for kids, the INC-K model, whole person care, person-centered planner, lots of efforts to integrate. But in California at this point, system of care is really on some level a clearinghouse for all of those efforts potentially. We should also add, by way of level setting, Steve, thanks, that our last 3 years or so, 4 years now, Breaking Barriers has been emphasizing what we would characterize as 4 pillars. And those pillars or anchors of the collective work really are shared leadership, shared information and data, shared financing, and a shared sense of community. And so each of our master classes, beginning with today, will focus on one of these going forward. We would call your attention really quickly to the resources that are available at breakingbarriers.org. There is a toolkit there that takes the form of these 4 pillars, and you'll find a host of resources. There's 6 or 8, maybe 10 resource links within each of those pillar areas in that document. So please avail yourself of that. I'm sure Jamie will toss the direct link into chat at some point. And there is also a Breaking Barriers YouTube page where you'll see posted there various presentations from the last couple of years of Breaking Barriers. Steve?
Yep, and so just as a quick review, in February, we launched this master class series with Elizabeth Estes highlighting this one child, one plan, because we want to break state and local barriers and build bridges in support of whole child and families, so that we want to have this plan to improve the health and well-being of children and families and well-being. And it has, we've been using 5 lenses, which you see over there on the side, that it be youth and family led, that it be grounded in equity and justice, and clearly that's so incredibly important in this day, in this week, that it be culturally and linguistically responsive, that the community own it, because as somebody once said to me way back when in New York, commissioners come and go, leaders come and go, budgets come and go, but the one thing that's constant is the people that live in the community. And so that we need to really how do we engage them so that they feel like they're collaborative partners? And obviously all the work that we've learned that it should not be deficit focused, but really strength based and engage their aspirations. That was our launch. And for those of you who were here last time, this is our concept map that I don't want to, you may not want to know how many versions we had to create to make it even this simplistic. But clearly what we're trying to do here is highlight how in a community, all of these heretofore silos can work together in a more comprehensive and coordinated way. And down on the bottom, the three different colors that surround it is this idea that, and for some of you have been around for a while, you remember universal, selected, and indicated as a public health approach. Now we have primary, secondary, and tertiary. For those of you in education, we've listed the integrated systems framework, which has, again, the same idea about we want everybody to have certain information and resources and opportunities. And then as you have more significant and or severe needs, that we give you more and match that. We also have come to consensus, at least at this, for now, that this is really a 10-step process if we're going to go from where we are now to where we want to go in that kind of comprehensive and integrated care. And so without going through too many of those, just want to let you see that we've tried to make it so that it becomes sequential, it makes sense, it's achievable. And then Richard, do you want to highlight those 4 support anchors that we think are necessary to install it?
Yeah, thanks, Steve. I think those 10 steps are in some level universal to any collective impact effort. So they really do form the basis of the implementation work. Now that some of the design work is beginning to be completed underneath the system of care, the hard work, the heavy lift of construction begins. And so that's where we think implementation steps 1, 3, 5, and 7 from that prior slide. And you'll have this deck again at the conclusion, but those are really first priorities in most communities, not to suggest that others aren't important, but 1, 3, 5, and 7 are really the place to start, including the necessity to do some kind of a continuum analysis to identify where your local gaps in care are. Would emphasize that in most counties where the system of care work is being rolled out successfully, or where it has been in place previously, there has to be some kind of an advisory work group that's empowered by the executive body. Busy department heads and chiefs really, in most counties, will have a hard time finding the bandwidth to do the heavy lifting of the construction itself. And so the formation of some kind of an executive advisory group underneath or adjacent to that interagency leadership team will be super critical to your success. And in addition to that, finding the administrative personnel to support the entire system of care process is foundational. It's one thing to make a commitment to collective effort, but absent finding the right champions at the kind of operational level, and by this we mean finding the professional administrative support people to do your minutes, to do your agendas, to do your calendaring, those moment to moment, the kind of the blocking and tackling, if you will, of the connectivity. Absent that, the champions will have a harder time staying connected. So just a few things to ponder on in terms of the anchors to support the installation of your system of care work. And you'll hear reflected beginning today with the comments that I'm sure that Melissa and Judy will bring forward, and with the questions that you all will pose to them, an imperative to focus on, again, steps 1, 3, 5, and 7.
And to build on what Richard's saying, I don't think anybody who's in our field or works with children and families locally would disagree with our goals. But as you always hear, it's in the details that the problems occur. And so what we're saying here is that these first 4 steps, these 4 steps that Richard is highlighting, is a really good way to be able to make sure that you have the process and the wherewithal and the bandwidth and the wherewithal to address those details, because that's where it's going to get sticky. And you want to be able to move through that as quickly as possible. And then Richard,
yeah, a couple thoughts on shared leadership, Steve. Thanks. And then we're going to jump in here. We won't hit all these because we really need to get to your questions and to hear from Melissa and Judy a little bit, but would just emphasize the decision making and the accountability are critical. So this point 2, it's not enough to convene meetings with well-intended leaders. The group has to really, on some level, re-identify itself. It's almost a way of inviting us to shed our skin about the silo we're in, leave the siloed skin behind and put on a new face, new clothing, right? To bring ourselves into collectivism as part of a broader system, not just from the silo from which we join. Point 4 here is one of my favorites. Particularly the community-based effort, which we'll talk about in a couple of months, invites us to share power. And government-held systems are really challenged to authentically share power, right? It's just anachronistic to government, but the collective impact is only going to be evident to the extent that department heads and other key managers actually yield their power to one another, and then to those we serve in community with shared governance, which we'll get to a little bit today, I'm sure. My favorite abbreviated definition of a good system of care is that we're managing or sharing risk, reward, and responsibility. The 3 R's of good collective impact. Steve?
It's different than what I learned in school about the 3 R's, but I agree with you. All right, so now we're going to have an opportunity to hear from both Judy and Melissa, and we created some questions to get us started. I think once they start, you'll appreciate just their breadth of experience and vision and how they make things happen. So this first one, I'll start with Melissa, if you will. What does shared leadership mean to you and your interagency partners?
Well, I think Richard stole it, because in my head, when I think about shared leadership, I also think about shared risk, right? It's about we're in it together for not only the good things and the things that we're going to accomplish and the things we might get a pat on the back for, but all of the places where we take risk and are vulnerable, that we can be authentically human, that we are able to have grace for one another and the process. So shared leadership really is taking the good and the bad together.
Love how you included grace. It's usually not in the professional literature, but critically important. Judy, and for you?
Well, if I didn't say or so earlier, I wanted to make sure that I thanked you guys for inviting me here, because, you know, sometimes I feel like a leader and other times I really feel challenged, you know, in the work that we do. And so it really resonated with me when you said that earlier, that you feel like we're not in a marathon anymore, that, you know, we're getting towards the end. And yet I just feel that leadership is so much a journey and not necessarily a destination, right? And we might learn things, you know, take a couple of steps forward, and then we might take a couple of steps back because we're tested in terms of, you know, what we say we want to do. But I think in general, when I think about shared leadership and the way that our system is functioning right now, leadership, it really is about a commitment to do better because we know better. I think that everybody around the table, you know, has committed their lives to public service, to helping kids and families, and the body of research, the body of information, the trials and tribulations that we have all lived through are really informing what we're trying to do now. And I sense that there is just a commitment not to hide behind, you know, the idea that we're doing things correctly, right, according to the regulations, or we're doing what we're supposed to be doing. I think that, you know, the humanity of our work and the impact that we have in communities is really being elevated, whether it be because of the pandemic or because of the social justice movement that we're seeing in our country right now. I feel a renewed sense of commitment to better integrate our lived experience and the information and research that we know in order to do better. I also want to make a remark about what Richard called the Children's Services or Children's System of Care advisory team. He called it a CSOC advisory team. And ironically, I had in my notes in preparation for today wanting to talk about the leadership, you know, that we have locally, and how I believe that our group of leaders really is practicing a lot of humility, and I think they're doing that because I see them allowing change to be initiated by this CSOC advisory team that we have going. And that team that we have in Ventura County is represented by folks really at multiple levels of the organizations. It's not just the deputy level, if you will, but you know, you know, there's staff there that are actually living this work every day. And so I see that in a way as a model of humility, because they are allowing that information to come forward. They're allowing that approach to come forward. And it's really a change from below type of effort, if you will, because we truly are leveraging the line experience of staff in elevating the policy issues that we're grappling with right now. And I'm incredibly proud of them for that. And so I think that it was important for me to message that to folks.
Judy, it's Richard. Could we dig down on that one a little bit?
Sure.
I think it's super important. Can you ponder with the group today a little bit about how you're messaging? What are the communication strategies or tactics that you're using in Ventura to message that at other levels of your organizations?
Mm-hmm.
So I hope I am going to answer your question. So I'm a department head, right? And so I'm within the Human Services Agency. And so I really see my role as that liaison, if you will, between the ILT, even though I sit on the ILT team right now, I see myself as the liaison between the ILT and the Children's System of Care Oversight Committee. And so I really repeatedly impart to the members of that group, and in turn, you know, want them to share with their colleagues that dynamic that I just described, that we have leaders in this organization who are convening and discussing the 2083 MOU within the context of the staff's perspective. And in that role, you know, leadership, or I guess within that dynamic, leadership is no longer a role that, you know, is only related with or related to a specific title somebody has, but it really becomes a function, right? And leadership then can happen at any level of an organization, and the experience and thoughts and examples that staff are willing to raise in the advisory team meeting, you know, are also examples of leadership in their own right, and helping to transform our system. You know, it takes a lot of courage to be able to speak up and talk about, you know, the difficult situations that they're having. So
to build on what you're saying, Judy, yes, we've got the designated title interagency leadership team, but if we don't engage and have all of the informal leaders throughout our organizations, it's probably not going to have enough reach and probably not be sustainable, because we've learned about it. Yeah.
There's buy-in. I mean, there's buy-in. I mean, I feel that over the course, especially of the last, you know, 3-4 months, there there's not only commitment on the part of the leadership team, right, to do better because we know better. I think that sentiment is really embraced by, you know, everybody involved in this system transformation, because that is the message, right? We are on the cusp of transforming the way we do business.
Melissa, how are you, what strategies are you using to communicate in Sacramento? Because I think it's really important that this is not something that happens behind closed doors. There really needs to be an openness and transparency of it if we're going to achieve what Judy just outlined.
Right, and I think that in Sacramento, similar to what Judy described in Ventura, there are multiple levels of quote unquote leadership or positions that are participating in both in our advisory team. And although I'm not a signatory on the ILT, I am part of the advisory, and I do attend the ILT and participate in those conversations. I think also the one thing that I think has been very helpful for us, because we've included additional partners outside of I believe it's the 5 required partners, but we are learning each other's language. There's so many oftentimes when, you know, you begin to collaborate with a partner, community member, stakeholder, somebody, and you start to talk about something and you realize that you're using the same terminology or words or verbiage to mean very, very different things because you're coming from different system perspectives. And so we've been taking our time learning from one another about our own role, responsibility, perspectives, how we're serving the community, and learning what we don't know, or being able to ask those questions, having those really frank, hard conversations about what we thought, what or how we thought we could come together, and realizing that maybe we had some misperceptions or misunderstandings about roles and responsibilities. And that's been really helpful because that's really hard. It's really easy to point the finger and say, well, I thought that was your responsibility, or I thought you were doing that. And, oh, wait, I thought you were doing that. And so being able to do that in an open forum that's safe, and where people, that's the purpose of it, right? Is to say, hey, this is what I didn't know, or this is what I thought, but now I know I'm wrong. So we've been doing, I think, quite a bit of that in terms of sharing our subject matter expertise in a way that allows others to ask questions or to learn what their assumptions were that they didn't know about.
Well, I think both of you have described perfectly the elements that when we're trying to build trust and accountability. So if we don't have this information and don't have this space to be able to go back and forth, we all revert back to our old beliefs. That makes sense. Richard, you had a question from the chat?
Yeah, thanks, Steve. Stacy's posing a question. I see she's got her hand up too, so we can unmute her for some further elaboration. She's wondering about structured decision-making specific to financing. And I would just, while we unmute you, Stacy, feel free to elaborate, but we will hit on this in our second to last webinar. The third anchor in our series is about blending and braiding dollars. So, but we won't get there for a few months. So tell us a little bit more about your challenge at the moment.
Yeah, so thank you. I'm in our county in Santa Cruz. I think we're all feeling really, really hopeful about 2083, and we see great potential. We've been attending the Breaking Barriers now for a couple of years and really trying to get this shared responsibility for kids and families at the forefront of our work. My question is I'm looking for examples of groups that are being successful and having some kind of a structured decision-making process around placement, allocation of resources, things that require a financial commitment, and how do we have those discussions in a way that's child-centered and is safe without, I feel like that's kind of the place where I'm seeing that we back into our silos. When it comes to like the dollars and taking financial responsibility, it's a hard conversation. So I'm wondering if anybody knows of or is using some kind of a very structured, agreed upon plan for making those decisions, and if that's been helpful.
as Richard said, we're going to get to more depth in a few months, but I look forward to hearing what Judy and Melissa might say in response.
I'm intrigued by the use of structured decision-making because, you know, in child welfare, when we use an SDM tool, right, I mean, there's a standardized way of assessing. And so I'm assuming that that's what you are referring to, right? A standardized set of questions that we review in making a decision about who is financially responsible. No, we do not do that. I think that we try, and I'm going to say that with the utmost respect, that we constantly try to have to have value-based decisions, right? And so in our years of collaboration, you know, and in this effort specifically, we again review the values that, you know, we want to hold to and use them as a touchstone for, you know, for making those kind of decisions. And so if, you know, having the least intrusive intervention or doing what's best for the child and family is the value, then, you know, that leads the discussion. I have seen one or two agencies in particular really take a leadership role in assuming the financial responsibility and then building pieces of the partnership around that, right? Whether it be getting agreement after the fact to have another entity, you know, we're going to JV you for a part of this cost, et cetera, right? But the idea is to, you know, and I'm fortunate with the leadership in my organization, you know, that really, you know, Melissa Livingston is the director for the organization, and she leans into those values constantly. You know, it's do what we need to do for the child and the family, and we'll sort it out. You know, and so it's in that process that we are able then to, you know, have more difficult conversations and or negotiate, you know. Okay, so the child is where they need to be. They're getting what they need to. Now let's go back and figure out, you know, how are we going to share this responsibility? And that's the way we're functioning right now. You know, is first attending to the need of the child and then sorting it out afterwards. And so in subsequent examples, then I can tell you that it's a little the idea of sharing responsibility becomes more natural because folks kind of know what's going to happen.
All right.
But I took that leadership piece of let's do what's right, and then we'll go back and figure it out.
Yeah, you've got an exceptional leadership situation there, Judy. Melissa, how's it going for you in a different system?
Well, I had the same reaction around shared decision making and that terminology, because I also think of it from the child welfare lens. And so no, Sacramento doesn't necessarily have a structured set of questions to answer in order to determine who's funding what or how that works. But what I will say is that we have what I would say or would call these mini pilots or these opportunities that come up to do something that then results in shared financing. And I'm not sure that folks realize up front that the shared financing is the result, like that's even part of it, right? And it is about focusing on the needs of the children and families. So what is it that they need? What are the gaps? An example is we've had a gap on our very, very front end for both juvenile justice and child welfare, right? So being able to front load services or to assess, intervene, link way early in the process in terms of involvement in both of those systems. And so me offering up staff time, saying, you know, I'm not asking for money, but let's try this. I see that there is a gap. I see that families are needing something, right? They need to be assessed. They need to be linked more effectively as they're going through these court processes. How do we do that? And so offering up 8 hours of an FTE to pilot something and let's see how this works. Does that help? Does that improve? And then all of a sudden it's like, oh, we should, maybe we should expand that. Maybe we should write a grant for that. Being able to leverage local dollars from a partner and me saying, we'll do the administrative activity related to billing Medi-Cal. We will, allow folks to use the EHR and our claiming system to bill. We're not charging you for that. And those kinds of things, in my mind, just result in shared financing, even though that the shared financing wasn't necessarily the topic that got us there.
So Stacy, and the short answer right now is leadership that has value, is value-driven in decision-making, and a willingness to innovate. And I look forward to you asking the question again in a couple of months when we have the finance folks here, because I think that what your question raised for me is, how do we start to create some criteria so that we all know that we're doing it in a similar way, so that we don't run afoul of different mandates or different court counsel seeing and regulations in a different way. So thank you for that. Richard, you said you had another question or two?
Yeah, we had a couple of attendees submit questions prior to the webinar, Steve. So one of those was, how do you establish a process for delegation, which is an interesting word in light of shared leadership. So I wanted to explore that a little bit and give Judy and Melissa a chance to ponder on that with folks and see what emerges. But how do you manage this delegation process within a shared leadership approach? Any thoughts, Judy or Melissa, about what that delegation means? And then I've got some reflections as well on that.
I wish I had an example of like what kind of delegation, because there's different types of delegation.
Yeah, I'm assuming that the question invites that delegation applies across the spectrum of partnership, right? Which is why it's an interesting word, because delegation, I think for most of us, implies an assignment of responsibility, right? And so it's an interesting dynamic. Other thoughts about delegation within an interagency leadership dialogue?
I would just say leverage existing relationships, right? I mean, I think that if you have somebody I happen to have somebody who I work closely with who has, other established relationships. And so I'd readily delegate, to him things that where I know he can leverage those relationships.
I was thinking leveraging expertise, kind of that's similar, right?
Yeah.
I think that leveraging of expertise, as well as the first thing I thought of when you said that, though, is that who's got the bandwidth is part of the conversation around delegation as well, which is, I guess just a reality, part of the reality too.
Yeah. Well, my only closing reflection in addition to that is if the partners are having conversations about delegating at that peer level, I would just encourage kind of a reframing of that. Delegation, again, implies power up and down in architecture, at least for me. And it's really a term probably to be avoided. That would be my recommendation, that think of it more in terms of collective decision-making, right? So it's really peer-based decision-making rather than delegating from one to another. So the whole mindset is a shift from we need you to do this to how will we do this together, right? Different question.
Yeah.
I would add, and then even if I'm not there, I have trust that you'll make the right decision so I can live with what my responsibilities will be behind it. That's when you've really reached a certain peak.
Yeah, that trust, yeah.
But just as we keep moving, Richard, is there another chat box question right now?
Well, sure. Let's tie up the other question that came ahead of time, Steve. The question came from Alameda County's Behavioral Health. I really appreciate the advance on this. But the question was, how do we get buy-in from executive leaders to share leadership with community stakeholders? So it's specific to the leadership processing with community stakeholders. So similar to the question on financing and decision making, this is a topic of a future a masterclass late in the summer or early fall. But any early thoughts, Judy or Melissa, as your systems have begun to tie up their design work about engaging community partners outside, I'm assuming outside of your public system architecture, right? So beyond your 2083 partnership, is there a conversation about how to share governance or leadership with community-based organizations, your nonprofit sector, et cetera? Melissa, any early thoughts?
I feel like that we're doing that quite a bit in a lot of different ways in Sacramento on other projects. So I'm imagining that it will generalize. I think that we do a lot of community listening sessions and community stakeholder input sessions and community conversations. And I think that it was interesting that the question was about having upper management or leadership buy into that. Was that the question?
Yeah.
How to get buy-in from executive leaders to share leadership with community. So I think it is, yeah, I think it's buy-in from the public, the government side to do the sharing with community.
As public servants, I think that it's a really great reminder that we're public servants for the community, right? That's part that having that reminder or that constant is probably also a very good help or support to get buy-in. I think, as Judy said, they're all public servants at the table. Our executive leadership are public servants. And so constantly bringing it back around to the community as our boss.
Yeah. That definitely is a piece of it, and I agree with you that it is the way it's supposed to be, if you will. But it isn't always easy for folks to relinquish that power, because at the center to our work in social services is a power dynamic that we don't often talk about. And I think, again, during this time, where there is a spotlight on inequity and the need for, more community voice, it's important that, at the executive level, that we talk explicitly about, the paradigm or the lens that we are using for doing whatever work may be ahead of us. And so, we usually in public service or historically have had what's called a needs-based approach to the community, right? We see that there's an area of need and we think we know what they need. And the best story is, I'll quickly tell you, a public health, locally here did an assessment of a particular lower socioeconomic area in the county, and they found that they don't have access to fresh fruits and vegetables, and that's why their medical can have a higher incidence of diabetes. And so they knew what they needed. They needed to set up a farmers market in that community, and they did that, and nobody showed up to the farmers market, right? And so when they asked the community why that was, the community said, because I'm afraid of getting shot, right? And so they didn't really listen or even ask the community. They thought they knew what they needed. And so I think there needs to be a conscious effort to shift that paradigm, or to even identify, what is the paradigm that the leadership team is using with regard to engaging the community. I think that's where it starts. And then the other piece I wanted to add to that is, I would worry as much about, a leader's willingness to share power with the community as I would about the community's willingness to share or trust with the public. Because in my county, and I know I'm not unlike many other counties, our areas where we have the highest number of clients, participants, if you will, it is areas that are markedly diverse, a higher number of African American, a much higher number of Latinos in this area. And so if you think about their life experience, they, many come from Central and South America, where their understanding of government is that they are corrupt, they are in it for themselves, they are not really here to help us. In fact, they are here to exploit us, and we don't trust them. So, I would worry just as much about that piece as I would about, whether or not the public entity wants to share power. I think the public almost expects that, to be the case. And so that's where I think our work is really needed more, convincing. And to that, I would say, stay the course. Right? Again, this is a journey. It's not a destination, and it might take a whole lot of work to really get the community to trust us. And I found that to be the case.
Well, clearly, once the public sector and the MOU signatories agree on how they want to move forward, obviously they have to decide and develop strategies and mechanisms to have that community voice in there. I think Melissa and a few of them. The only piece I would add to that is too often we think the CBOs represent the community, and I think they're more of an intermediary, and so it really becomes an issue about how do we have representative voices, not just the ones that are convenient to us or the ones that we always reach out to. How do we start to make sure that that's a diverse group that can truly give us the right picture? Like in Judy's example, safety is even more important than healthy food.
Yeah.
And so that would be my suggestion and a piece to add. Who is the community voice and how diverse can you make that? And then have an authentic sharing of relationship and partnership. As we're beginning to wind down now, I would just let you see this next slide and see if there's one question or one bullet that you might want to respond to. If it was up to me, I would ask you, have you started to envision sustainability and how you're going to maintain this going forward? But that might be presumptuous at this point, because my sense is both of you are still in storming and forming, and so, but I'm always curious about where we're headed. So, but if there's one of them you want to make a quick response to as we begin to wind down, feel free.
Well, I'll again reference my agency director, Melissa Livingston, and she has even today in an email, and it wasn't the first time that I've heard her say this, but she says, we need to attend to the new playbook, right? We need to attend to the new playbook. And so, that gives me hope that, we're not time telling, we're clock buildings, to borrow a phrase from, that book Built to Last, right? So if we're creating a new playbook, then that means, we're committed to doing things differently over the long haul. And so I'm going to hang my hat on that. I think that is, exciting to have, leadership at that level and recognize that we need to have a new playbook, and that's one that's committed to creating it.
Well, thank you for that. Melissa, anyone you want to grab onto?
Well, I would agree that in Sacramento, we are still doing this storming and norming and forming and all of that. Absolutely, as we are learning each other. We do meet regularly. We meet every month. We do have emails in between, prompting us and reminding us to review things and read up on things. I think that some of the sustainability answers to that is about consistency and trust building, right? And being able to I guess have that shared vision and understanding of the long haul. It's that same stuff that Judy's talking about. It's not, it's not the we did this and now check and we're done. It is an ongoing process that will move from generation to generation. And the more consistent that the shared leaders can be, that will build trust. Other leaders at various levels will see that consistency. So they know that they can count on that those are the decisions, or that is the directions in the playbook, and everybody's is using the same playbook. All of that will, I think, hopefully create sustainable change.
Well, I can't wait to see the playbooks that the two of you put forward. I got to admit that. And for me, the point of it is having the playbook clearly articulated, or the culture already set, means that when people leave, it doesn't fall apart. Then you have new people, you're just onboarding them into the ongoing culture and the playbook, as opposed to having to start from scratch every time there's turnover. And there's always turnover.
Yeah.
So,
Right, and it should be built into the culture, right? So as folks come and go, the culture is that we are consistent, that we follow through with what we say, that we are all working off of the same playbook, and that that's just the way it is. It's not because it's written down. It's because that's how we treat each other.
And it's not because it's Melissa or I like Melissa.
Correct.
Yeah, I get it. So Richard or Jamie, are there any, in these last few moments, any reflections, observations, or inquiries? Let's open it up to folks that have been listening to all these pearls. And
Yeah, no, I appreciate that. Just want to be sure to give Melissa and Judy any final opportunity to reflect on anything that maybe early lessons learned. Is there one lesson that you've learned in the first year or so as you've been having the conversation? Maybe there's a nugget that you could share, and see what comes from that.
I just always tell myself not to lose, not to lose hope, that there's going to be fits and starts, and, there's, again, one step forward, one step back or whatever, but you got to acknowledge the successes, and when things go well, and you got to come back, the next day and keep trying. It's that commitment.
Judy, thanks. In fact, just to reflect a little bit deeper on that, it is in those moments when the partnership is stressed and when there are challenges that in working through those, the trust deepens, right? So when there is a rupture, when there is a conflict and the collective work actually binds us to a solution, that's when the deep, really deep trust forms from that scar tissue, if you will, of the conflict. So trusting that ability of the executives to work through that is really profound. I love that. Thanks for the reminder. Melissa, anything from your world?
I think that what is interesting and always a good reminder is that no matter how long we are in our tenure of our career, no matter what job title folks hold, that there is still a sense of vulnerability when we come together to work together, to collaborate. People are really comfortable in their own roles and in their own responsibilities. But as we come together to share something, it doesn't matter at what level folks are, there is that sense of vulnerability that people are bringing to the table, and to honor that and to respect that, I think is really important too, to recognize. And I too want to thank you for the opportunity to be here today.
Well said. And as much angst and work and accomplishments, steps forward, steps back that we've had over this last year regarding the 2083 and creating this integrated system of care, the other day it dawned on me, this is in the midst of a pandemic that's been unprecedented, and we've been managing all of this. And so my message is, we should all give ourselves a little slack for how fast we're going or how slow we're going, how many steps we've gone zigzagging, because when I look back, I'm just amazed at how far we've come given the circumstances of what we've been managing, both in our own agencies, in the community, and the people that we serve. So I did want to say that. And then we want to begin to seed what's going to happen for the next one, which is the next masterclass is going to be around data. And so we want you to start thinking about not necessarily, well, Judy and Melissa, of course, but all the participants as well, to start thinking about how is your ILT and the operational teams working around data, because often data is the more obvious problem spot. We don't even get to finance, we get stuck on data and sharing. So we wanted to make sure that people are beginning to think about that, and please forward your questions sooner. That's how we seed it to the subject matter experts that we're having. And then again, just to let everybody know what's our schedule going forward. The next one will be in June 16th around data. Some of you have already seen, who've been at Breaking Barriers, have heard Daniel and Kate present. They're brilliant. And then finance will be in August, and shared community will be in October as a way to bridge to next year's Breaking Barriers Symposium. And with that, Richard, any closing final thought?
Just a thank you to you, Steve, to Jamie for help behind the scenes,
Absolutely.
and to Judy and Melissa for their expertise today. Thank you so much.
Yeah, thank you. My hands go up to both of you. You've been brilliant. We chose wisely, Richard. We chose wisely. Anything else? Anybody in the participants who wants to have the last word?
Just seeing lots of thank yous. Appreciate all that.
Yeah. All right, well, then we finished 1 minute early. Enjoy it. And we'll see you next time. And again, thank you to everyone. Stay safe, stay well.
Bye.
Bye now.
Thank you.